Good morning and welcome to the Lane County Board of Commissioners meeting for June 2nd, 2026. Good morning, Mr. Mokrzycki. Good morning. Council Bovet. Good morning. Do we have any adjustments to the agenda?
Not from staff, no.
Seeing none. Any emergency business?
No.
Okay, on to public comment. Thank you, Rio. Speakers will be taken in the order in which they sign up and will be limited to 3 minutes. Your time will start when you come to the dais and state your name. First up, we have Charlie Ross. We'll go back to Charlie. Do we have a Janet Ayers here? Okay, come up. We'll give Charlie time to grab some water.
Good morning. Thank you for the opportunity to speak in a public forum. I'm here to speak to the Navigation Center and the costs, both social, societal, financial, and the message it sends to citizens that are living near that place. Are you all 5 commissioners? I'd like to know if you're aware that there is razor wire strung up around that site, and all the years that that building served the VA very well. There was never a strand of razor wire. It's supposed to be a voluntary low barrier or no barrier site. The evening I drove there to check out the number of cars, there were 11 cars. The parking lot was not filled up. The little security guard building that taxpayer dollars paid for, the big heavy-set security guard came out from the building. I asked him where the security guard was for that house. He said, that would be me, but there's not enough money for me to go out there and guard from that location. He's in there. I'm here to encourage all of the commissioners to put a stop to this nonsense. These people were running out of money. I am taxed to death. I'm 73, and I'm paying close to too much money in property taxes. I'm emptied out. I'm emptied out. The county must tighten up their belts, just like us citizens, the common people, not the PERS people, but the common people. And I encourage you to put a no and stop the insanity. Relocate it if you must, but use some economy in it. The weather's nice. You can do tents that are managed. And if they're putting razor wire up around a building, something's not working well for that NGO to run that operation. Thank you.
Thank you, Janet. Next up, we will have Charlie Ross. Charlie Ross? Okay, perfect. Your time will start when you state your name.
Charlie Rojas. I have 3 questions for you, including for you, Commissioner Farr. Are you aware that there is a razor wire top barrier wall between Navigation Center and the Riviera Center? Okay, I'm going to take that you don't know. So that kind of answers the other question. None of you have bothered to ask the owners of the Riviera Center why they were compelled, or the businesses there, why they were compelled to put that barrier there. We've been living there in that area for many, many years. And when it was the VA clinic, there was never any barrier there at all. So I have to ask you why you have not done your job. That is a major business that provides quite a lot of tax revenue. And the city, both the city and the county, I know are in financial trouble. So why have you not bothered to ask or follow up with the situation that's going on down there that will directly affect the capacity for you guys to do your job, for this county and city to do their jobs? Because without that tax revenue, we're not going to be able to get that thing going. So of course tax revenue or property values are going to fall. And maybe that's the whole point. Is this a device to try and lower property values or that property value to the point that some developer can come in, buy it on the cheap and redevelop it? It's a question I've been asked, and I've been asking for quite some time. And nobody seems to answer or even attempt to answer. But at this point in time, I don't think I have much of a choice. We have a serious situation going on down there that's directly affecting our capacity to even function. Because I know my wife, before she died, used that venue quite a number of times. Sorry, I'm getting emotional because I just remember her going there quite a lot. And now she's gone. So anyway, I would ask you folks to please do your damn jobs. Go in there, talk to the owners, talk to the businesses, and find out why they are requiring or why they're compelled to put in that barrier and what is going on down there.
Thank you for your public comment. Next up, we have John Crowder.
I want to thank you for the opportunity to speak before you folks. John Crowder, I live in Santa Clara. And I should have had some water this morning, so not sure if I can talk very well. So I want to talk about safety and I want to talk about decisions. So 11 months ago, there was quite a bit of time spent by you folks and the community to talk about the Navigation Center. And I know you were presented a lot of information from one of your organizations on how great the Navigation Center was working. I don't know if a lot of time was spent on the effect on the community. There were probably, I think, 20 people that did public comment, and they were very upset about what was going on there. And so now, 11 months later, and you made the decision to move forward with it because it was beyond the June 30th or July 1 contact. So what are you going to do now? You have and glad I didn't prepare something earlier because two folks spoke before to talk about things. So you have a commercial area. I know one of the fast food companies there has had to move their soft drink area inside because it was a revolving door of people coming in and just using it and leaving. One of the businesses there now has a piece of plywood across their window. You've heard about the razor wire. So let's go back to safety. I think responsibility of you five folks and the county is to provide safety for the residents. The residents of the community are the people that live there, not the transient people that come in. I'm aware that you have a contract, and I guess it's good for 10 years. The building has to be used because of state funds. So moving forward, what can you do? My suggestion is you void the contract with the existing client that's in there, and I think you still have to use it for the same type of use. 11 months ago, somebody said they could do the same job for between 20 and 25% of the cost. So do away with the low barrier, get people in there that you know their past history, and maybe go back to that person that said that they could do it for substantially less money, might help your budget. And the key is to make a decision, and that decision has to be made not necessarily for the people in the facility, but the residents of the community that pay the tax dollars. It's a great community, and right now it's going downhill. it's really going downhill. So you have a decision to make. I hope it's the right decision for the people of the community. Thank you for the opportunity to speak.
Thank you. Rio, looks like we have a couple more here in Harris Hall. And we have one more. Oh, it's Gabe. Gabe, you're up. Your time will start when you state your name, please.
Gabe Piavich, father of 3, Lane County resident out in Elmira, founder, executive director of Everyone Village. I stood up here a little less than a year ago, and we talked about the same exact thing. And I'm excited to be back here today. Thank you for your comments, folks in that neighborhood. And I'm here to suggest that this is the team. This is totally the team. You're on the team, 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 I'm on the team, we're on the team. We can do better, absolutely. I have zero doubt in my mind. Furthermore, we can do better for a much, much affordable price point. I've been through it, tooth and nail, pick and comb, more than any of you have. Maybe you've done it more than I have, but you're over a lot more than I am, so I doubt it. We don't need to spend $2.3 million for that. What you just described, we're spending $2.3 million a year for that. So my suggestion is water under the bridge. We don't gain anything by coming at each other over past things we could have done better, should have, would have, could have. I don't live that way. I hope you don't either. I live with what do we have in front of us today, what is actually real, and what possibilities do we have together. I don't know that there's a single aspect of what's in consternation phase with the county right now and its leadership that could get better quickly, more quickly than the Navigation Center story. Absolutely. I know of myself and Everyone Village as a provider is fully capable of doing a good job with that program as deemed the requirements by the state. Absolutely, we can meet all those and we can do so for far less. There isn't direct correlation comparables. The county is going to come in later with some administrators. They're going to start talking to you about acuity. It's not enough to explain the discrepancy between our funding allotment due to, as per county suggestions, for $722,000 for the next year compared to $2.3 million. That gap is too large to be explained solely by acuity. A little bit, not all of it. So those funds in such a tight economic time, my suggestion is let's roll up our sleeves, let's be deft, let's be strategic, let's be a little bit risky because demanding times require that kind of leadership. And I know those leaders are in this room, so I'm excited to see what we can do better starting today, going forward into the next year. And there is no need whatsoever, in my opinion, and I know a little bit about the sheltering game and what's going on over there, and I talk to all the people all the time, from clients, folks still living on the street, all the way up to administrators of these sorts of programs. We can definitely do better. And we're happy to help in whatever way possible, and we know what we're talking about. We've just signed a contract to work with organization of business owners in the downtown core to bring the downtown core back to health. Everyone Village has a model that works. We're happy to share it, and we're happy to do whatever it takes to make this better for everybody. And I can't wait to see what we do. Thanks, gang.
Okay, thank you very much. Jessica, do we have anybody online?
Yes, Chair, we do. For those joining us virtually, if you would like to give public comment, please raise your virtual hand now. Thank you. I see 2 hands raised. Carl Darwin, you will be first. Would you like to be on camera for your comments?
I don't have a camera that's working.
Very good. You will have 3 minutes, and I will start the clock when you are ready.
Okay. Well, I'd like to first start off by saying amen to everything the previous 4 speakers have said, or I guess, yeah, 4. I really support the idea of Pastor Gabe getting in there and running that thing right. I feel like there's been several disqualifying factors with the current NGO that's running that show. First and foremost, the fact that they didn't change their policy on level 3 sex offenders until they were called out. And I know that because I was at the meeting in River Road. That policy never changed until they were called out. I won't name any names, but there was a level 3 sex offender on the corner of Silver and River Road for months on end that was 100% in interactions with high schoolers. It's not appropriate. It probably was illegal. There was nobody babysitting these level 3 sex offenders. There's been multiple level 3 sex offenders in there. They claim as of last year that they changed their policy, but that's a disqualifying factor. That is a lack of judgment for the community well-being. It's a lack of judgment for the safety of our children. Right there, full stop, disqualification. Beyond that, at the last meeting that we had a year ago, or a little less than a year ago, the lady mentioned that they're on their third director. That's a disqualifying factor. They're just rotating out directors. The buck never stops because they just get a new buck. It's not okay. They need to be held to account. And if you've got a new director, there's nobody being held to account. I'd like to point out that Gabe's not gone anywhere. Gabe's been here doing the good work for years and years and years. The buck stops at Gabe. Our community deserves better. We deserve to have a program that is not feckless, that's not destroying the nearby businesses and community, one that assures safety for our children that are less than a quarter-mile away. We deserve to have a shopping center that's not wrapped in barbed wire and razor wire. And I'd like to point out, they put that razor wire up so that people couldn't sit back in the back there and do drugs. But there are people right across the street from right across the alley from Navigation Center where all those dumpsters are lined that get into between them dumpsters and do drugs right across from the facility. It's not okay. We can do better. Our tax dollars demand it, and our neighborhood does. Thank you.
Our next speaker will be Naya Ross. Naya, would you like to be on camera?
Yes, please.
All right, just one moment while I promote you. Okay. We can see you and we can hear you, and go ahead and begin when you are ready.
Thank you. Grand Rising Commissioners and community members, I am Naya Ross, the ED of Honey Inc., a nonprofit serving multiracial, African-American, Black, immigrant, refugee, and ethnically diverse and low-income youth and their families throughout Lane County. I'm here today because we need help. Due to unexpected reductions in grant funding, our Multicultural Summer Academy is at risk of being canceled. We are facing significant funding gap and urgently seeking support to continue serving youth this summer. Our Summer Academy serves over 200 young people from across Lane County. We provide academic support, leadership development, cultural enrichment, mindfulness, SEL, and wellness activities, career exploration, nature excursions, healthy meals, and caring adults to reflect the youth being served, all at no cost to families. For many working families, this is critical childcare. Summer months are especially challenging because school is out, childcare options are limited, and many families can only afford 1 or no weeks of most summer camps. I've witnessed situations where older youth are left responsible to care for younger siblings during the summer while parents are working. Sometimes these situations can be unsafe and they place tremendous stress on young people who should be able to enjoy being kids themselves. Our program helps solve that challenge. We provide safe, structured care and enrichment for younger siblings while creating meaningful leadership, career exploration, and personal growth opportunities for teens. Every young person deserves the opportunity to experience the joy of being a youth, regardless of their family's income circumstances. For many youth, this is much more than a summer camp. It's a place where they feel seen, valued, connected, and belong. This year, we have a record number of middle and high school youth registered. These are young people who could spend the summer isolated, disconnected, and glued to screens. Instead, they are choosing community, leadership, and they're choosing opportunities to grow, heal, and connect with others. I want to emphasize that this work is prevention work. It is youth violence prevention, behavioral health support, substance use prevention, and suicide prevention. There's a mental health crisis impacting young people across our county, particularly Black and mixed youth. Last summer, I witnessed firsthand how meaningful connection, cultural responsive support, mindfulness practices, and simply having safe spaces to belong positively impacted youth who were struggling. In addition to supporting youth, we hire teachers, educators, and college students during the summer months, creating meaningful employment opportunities Today, I'm asking Lane County for help. Is there emergency funding, prevention funding, childcare funding, or funding because the county identified racism as a public health crisis? I'm also asking our community for help. Are there partnerships, building spaces, food support, or connections to other resources you can help with? The cost of prevention is far less than the cost of intervention. The cost of connection is far less than the cost of crisis. Our multicultural and ethnic neighbors rely on these opportunities, and losing them would have significant impact on hundreds of youth and families across our county. Thank you for your time, thank you for our service, and thank you for the commitment to the well-being of our community. With gratitude. Sorry, I had to speak fast.
You did great.
Chair, returning it to you, that concludes our online public comment.
Okay. All right, well, thanks everybody for your public comment. I appreciate it. And next up, we will look at the consent calendar. All items listed here are considered to be routine and will be enacted by one motion. There will be no separate discussion of these items. If discussion is desired, that item will be removed from the consent calendar and will be considered separately. Vice Chair.
I move approval of the consent calendar for June 2nd, 2026.
Second.
We have a motion by Vice Chair to approve the consent calendar for June 2nd, 2026, seconded by Commissioner Lovell. All those in favor signify with an aye.
Aye.
Motion carries 5-0. Okay, so that, we will recess the Lane County Board of Commissioners for a brief moment while we hold a joint meeting with the Board of Health and the Board of Commissioners, Health and Human Services. Item 5A.
Just,
Oh.
I noticed that too just now.
Yeah, that's just a consent calendar, yeah. Lane County Board of Commissioners meeting is back. We are re-adjourned. Okay, Health and Human Services, item 6A.
Do we want to, we need to move.
Need to
approval.
approve 5A as but it's just a consent item. But
Oh, gotcha.
you're sitting
yes.
as the
Yes.
Board of
Second
Health
item, yes.
separately from the Board of Commissioners.
Okay,
Ready?
motion. Yes.
I'll move approval of the consent calendar for June 2nd, 2026 for the joint Board of Health, Board of Commissioners.
Second.
Okay, we have a motion made by Vice Chair and seconded by Commissioner Lovell. All those in favor signify with an aye.
Aye.
Okay, both consent calendars are now approved. On to our Health and Human Services item 6A. I see Eve Gray coming up here.
Yes. I am going to recuse myself from this particular item. It involves St. Vincent de Paul of Lane County. I am related to the Executive Director Emeritus of that agency who's still employed. So for that reason, I will move out of the dais and I'll come back when you're done.
We will come get you.
Just give an opportunity here. So this is a routine item, would have been on the consent calendar with the other continuum of care contracts that you approved, except for the need for the vice chair to recuse. I'm happy to answer any questions if there are any.
I don't have any questions, Chair, but I'm happy to make the motion if
Please.
you're ready. I move approval of Order 26-06-02-05 in the matter of approving contract actions with St. Vincent de Paul Society and delegating authority to the county administrator, their designee, or their sub-designee to sign the approved actions.
Second that.
We have a motion made by Commissioner Trigger to approve Order 2606-0205 in the matter of approving contract actions with St. Vincent de Paul Society and delegating authority to the county administrator or their designee or their subdelegate to sign approved actions, seconded by Commissioner Lovell. Do we have any discussion of the motion? Seeing none, I'll call for the vote. All those in favor signify with an aye.
Aye.
Okay, thank you.
Okay.
Okay, and I believe
Ms. Gabb's going to come up and save me with the PowerPoint. Thank you so much. Okay, so it has been a while since we've talked about EMS funding, except for Vice Chair Buck, who has been involved in the ongoing conversations with the task force that all of you approved. So this is just an update on where we are. I am not asking for any decisions or action today, but want to make sure that you're updated on the conversations that are occurring. Okay, so kind of going back to what was the original reason that that the county put together and hosted a task force on EMS funding, because of course we do not run any EMS agencies. But this has to do with us being responsible by statute for ensuring that there are EMS services, transport services available across the entire geography of Lane County and meeting certain requirements for responsiveness. So we assign ambulance providers to ambulance service areas. We monitor performance regarding their response requirements and timelines. And then if an ambulance service area becomes vacant, we are responsible for identifying another provider to fill that. And we being you all and me, we are both called out in the code as being responsible. Okay. So the timeline, this started back in October of 2024 when Oak Ridge, who does have an ambulance service area, was concerned that they may not be able to maintain that ambulance service area. So we came to you at that time talking about the challenges and feeling the need to get the community together. Oak Ridge did some difficult work in order to identify some additional funding within their jurisdiction that caused the need to become somewhat less pressing, but still important. So we had requested an extension in late January of 2025, and then came back to you in June of 2025, almost a year ago now, asking for approval to begin an EMS funding task force, which you provided at that time. We did include within the task force representatives, both one elected and one non-elected, from every transporting agency. And we also, from the county, I sit on that task force, as does Vice Chair Buck. Okay, so where are we now? Things continue to be a really significant challenge in the ambulance funding world. So we did receive notification recently from South Lincoln that they were going to vacate ambulance service area number 2. So that is just a sliver at the very northwest part of our county, above what is served by Western Lane Fire and EMS. And it had been, some of those slivers exist in our county just because of other jurisdictions and how they were operating at the time the ambulance service areas were assigned. But Yachats Fire, which contracts with South Lincoln, really felt that they needed to concentrate their services within their own county, within Lincoln County. So that led to them making the decision to vacate ASA number 2. This was not anticipated, but ended up being good timing that I had this presentation today, because Western Lane Fire and EMS is wonderful and really very intently focused on serving the community and making sure that the coastal community has access to ambulance services. So I attended their board meeting last week, talking to them about the need around ambulance service area number 2. Their board did vote to say that they will accept that ambulance service area should the Board of Commissioners assign it to them. So we are in the process of, and this is the first step of that that process, this opportunity, and this presentation to notify you that that will be the staff recommendation for managing this vacant ambulance service area. And we will be needing to have 2 public hearings and then a vote from the Board of Commissioners to determine whether you would, whether you agree that you would like to follow the staff recommendation to assign that ambulance service area to Western Lane. So I can pause there and see if there's any questions right now, but there will be opportunity in public hearings to talk more about that. I just had to get it out in the public today because it is a time-sensitive issue.
Commissioner Farr.
Thank you, Chair. Just for clarity, this is the area that's kind of nestled between Cape Perpetua and Hasita Head. So whichever ambulance service serves it has to go over a headland to get there.
There are situations where it would be faster for someone from Lincoln County to respond. And in those instances, all of our ambulance agencies have mutual aid agreements. So they can reach out to partners and identify, is there someone else who is positioned better to respond to an emergency if it's a time-critical emergency, and manage that in the moment.
That covers it, but we have Lane County has a beautiful shoreline, and we do have headlands, which are difficult to navigate. Anybody who travels that area knows that it's not, it's not Beltline Road. That said, so the people who live in the Sea Rose Beach area is basically the most densely populated part of that area. Is that correct? That's where the sea perch is and Ocean Beach.
I would have to look at a map to confirm that. The estimate it is based on looking at the number of structures that are in their ambulance service area. It's 200 to 300 people. In 2025, there were 16 calls for ambulances in that ambulance service area. In 2026 to date, there have been 3 calls. So the volume is not high, and the response time, knowing that it is a rural area, is longer than our urban response times in terms of the requirement.
Thank you. And my point is that it's a pretty isolated part of the Oregon coast. In fact, there's no cell service there. So, okay, thank you.
Commissioner Trigger.
Thank you. Forgive me if I missed this, if it went by in the presentation timeline-wise. So West Lane voted just last week to approve the assignment their assignment, should we choose to assign it. But what is the timeline? South Lincoln vacated effective immediately. Is there currently no service? I guess is my question. What is the timeline? You said there needs to be a public hearing. Maybe that's coming up in your presentation, but it's a timeline question.
Yes, so the requirement was 60 days of notice, so it will be right around the end of the fiscal year. We will not be able to meet state requirements for noticing public meetings and holding 2 public hearings by the end of the fiscal year. So we will be working with the current ambulance service area holders to ensure mutual aid coverage in any gap period with our ASA holder.
And that was my next question, is what state mandates are in place and how do we accommodate them given the timeline crunch that we're under? And then what ultimately, there's sort of no choice, it seems like, is what you're saying. You can't leave a community with no coverage.
The choice, if, the choice that would be available, and we can talk about all these choices at the public hearing as well, is we could run a request for proposal. But that would not get us to a solution in the rapid timeframe that we're hoping for, and that is a request for proposal is not strictly required by either code or statute, from what I understand. And I'll look over to our county counsel to see if he has any different perspective on this.
I don't. We have to have, the statute specifically says we can't do an emergency ordinance, so we've got to have at least 2 readings.
And an RFP, putting out an RFP does not guarantee response to that RFP.
That's right.
So, yeah, okay. I think that's all I have until the hearing. Thank you.
Okay. Thank you. Appreciate you all, your grace with that deviation. Just breaking news all the time around here.
No, I sure appreciate it too, Ms. Gray, because I did get you know, there's not a lot of calls out there. There's a lot of concerns out there about the lack of services. So at least this will provide some clarity and certainty when we get it done. So thank you very much. I appreciate it.
Thank you. Okay, so what else has been happening? In the primary election, 2 fire districts who serve ambulance service areas within Lane County had funding measures fail that they were really relying on. So South Lane has sent us some information on some service reductions. None of those impact their requirements as an ASA holder. It just impacts the types of calls that they will respond to and what they need to hear over the radio to feel that it's an appropriate call. They also will be working with a private ambulance company in order to cover some of their calls, inter-facility transports, and even some potential life-threatening calls if they are required to move staffing over to fire engines. So it will be based on their staffing, whether they can staff their ambulances and their fire engines, or whether they need to rely on their subcontract in order to staff ambulances so that they can staff fire engines. Because, of course, for a fire district, their statutory obligation is fire protection. The ambulance coverage is something that some of them choose to do, but is not an obligation under the statute. Then Lane Fire Authority also had a funding measure that did not pass. I have not heard from them formally around what their plans are, but do know that they are working very actively to create a budget and to work with their bargaining unit around what the potential options are for them. So once I have more information from Lane Fire Authority about what those impacts to service will be, I will communicate that to you all. And beyond those funding measures, every ASA holder is barely hanging on. So this work continues to be really critical in identifying what are the potential pathways that could help to stabilize the availability of ambulance services within our very big county. Okay, so the task force meetings, we kicked off on July 18th of 2025 and then said to all the fire chiefs, we'll see you after fire season, because we really couldn't take up their time in the midst of fire season. But in that downtime, we were working on gathering data from the agencies for comparison purposes. We did discover everyone collects data a little differently, and we can't necessarily make apples to apples comparisons, but we can get some general themes out of the data that we collected. We then met to review and refine data 3 times in the fall timeframe, and then in the winter and spring have met a couple of times, and at this point have decided to assign some subcommittees. One that is the operational fire chief personnel or their delegates, who are really talking about what systems changes could we implement that could potentially make us more efficient, and then some of their recommendations and will go to a policy group that will be more of the elected officials on that group to think about what are the policy changes that we could advocate for, not just locally, but at the state level as well, that might help to stabilize EMS outside of just looking at local tax funding as solutions. Okay, so what are the issues that we have identified so far? So the first one is just that unlike other healthcare institutions, which are supposed to be able to provide care, bill for services, and pay for their operations, that structure does not work with ambulance services. And it used to. Back in the time when Medicare and Medicaid paid fair rates and allowed for billing of patients for ambulance coverage in order to cover the cost, it used to be that ambulance services could cover their costs with billing revenue. But Medicare and Medicaid both put into place very strict reimbursement caps for their services and laws that prohibit billing the patient. for any portion of the transport services that are provided. Compare that to folks in the commercial market or self-pay who receive very, very high bills for ambulance services when they do call for an ambulance. So what that has done is it has driven a system where people who are commercially insured, whose insurance actually pays better, that is the payer mix that generally supports the healthcare system, but folks in that market are afraid to call 911 because they're afraid of the bill. And so you have people who are having a heart attack who are trying to drive themselves to the hospital because they don't want the ambulance bill. Meanwhile, the lack of any obligation to pay for other populations drives much higher utilization. When folks can't get into primary care timely, they have difficulty with transportation to urgent care, they have an issue they're not quite sure, and they'd like to just get it checked out. That, as well as emergencies, certainly everyone is calling 911 for emergencies, but with the populations where there is no financial impact to the patient for calling 911, we see a higher rate of inappropriate utilization, and that is impacting the system. And the fact that we can't rely on commercial payments to make up the difference in our lower government paying plans leads to a situation where ambulance services cannot self-sustain without tax dollars. So I already alluded to inappropriate utilization. We have a healthcare access problem in our community. I think that's not going to be a shock to anyone that I say that. And this leads to increased strain on the ambulance system. People who either don't know how to navigate the healthcare system or are unable to get timely access to care in outpatient settings, who either jump to ambulance or their condition just worsens because they weren't able to access care before it became really bad. At that point, the ambulance system is the medical safety net that's left in our community in order for people to access care when they run out of other options. So we see 911 being utilized because of lack of access to primary care, lack of ability to be transported to appointments. So if you're in a wheelchair, you can't just call an Uber, and you may not be able to afford to call an Uber anyway. So there is a big transportation need around urgent access that can't always be met through people's other options for transportation or their other insurance coverage. There are some folks who believe that if they go in an ambulance, they won't have to wait in the ED lobby, which we all know is not a pleasant experience. So that is sometimes a motivation to call 911. And then there's just lack of knowledge about how to navigate the healthcare system. Someone who didn't know how to fill their medications, and now their condition has worsened. Someone who missed their follow-up appointment with their specialist, and now their condition has worsened. There are all kinds of things about people who are unable to effectively navigate the system that leads to worsening health conditions, that leads to these 911 calls. And we also know that our local hospitals are unable to accept patients timely from our ambulances, and that leads to ambulances waiting at the hospital for available staffing and available rooms to be able to drop their patients off. That is particularly impactful to Eugene Springfield Fire and taking up ambulance time for waiting at the hospital. Okay, uneven tax base. This is, I think, the most, the issue that elicits the greatest sense of lack of fairness in the conversations that we are having, and one that I do think that we need to have some deeper conversations about how to address. So everyone receives ambulance services. It is state law. Everyone receives ambulance services. Not everyone pays taxes to support ambulance services. So for our ambulance service areas, they are able to tax within, when they're municipally owned and run, they're able to tax within their city boundaries. When they are fire district owned and run, they're able to tax within their fire district. But all of our ambulance service areas, I believe, serve a broader geographic area than is supported by their tax base. So this means that the tax base of our ambulance service providers is supporting people who are not paying taxes and receiving the same service. It's a point of big contention, and actually it came up last week at the Western Lane Fire and EMS Board meeting as well, because ambulance service area number 2 is mostly not within Western Lane's taxing district. There's a tiny little sliver of it that is, but most of it is not. And so accepting that additional ambulance service area means that there's again, this increase in this sense of uneven taxation. Okay, and then EMS structure is no longer aligned to our community needs. So back in the day when we thought that people would only need to call 911 ever for a medical emergency, rules went into place that said, well, ambulances, because they're only going to be called to emergencies, can only get paid to take someone to the emergency department. For the most part, ambulance providers cannot be paid for the care that they provide on site. There are some exceptions to that, but it's pretty extreme scenarios for them to get paid for the care that they provide on site, even if they stabilize someone and make them better for all intents and purposes. They cannot bill for that. They cannot transport to a non-emergency department location and get paid. So they can't take someone to an urgent care or their primary care. The ambulance companies now are or ambulance agencies now are doing much more work with care navigation too, trying to help troubleshoot and problem solve. Okay, you couldn't fill your prescription. Let's talk about an option that doesn't involve you getting in the back of our vehicle and going to the emergency department. Let's talk about how to get you your prescription. And these are real ED visits that happen. And our EMS agencies are trying to prevent them, but they receive no reimbursement for doing so. And transporting sick or disabled individuals home from the hospital. This is a big issue in our rural areas where maybe someone had to be transported to River Bend for care, but they live in Oak Ridge or they live in Florence. How are they supposed to get home if they are medically frail and don't qualify for a taxi service? So these are some of the things that our ambulances are being called to do that don't lead to any form of reimbursement.
Ms. Gray?
Yes.
A question about that. So there's like secure medical transport and so on. Those are private companies that people can pay for if they can afford it? Is that what happens with that particular discharge to your home from the hospital question? Are they not part of this system?
There are a variety of transport agencies which work in certain circumstances, but not all circumstances. So we still are seeing ambulances being called to assist with this.
But those are private companies, those things like secure medical transport and so on?
Yes.
Okay, thank you.
Okay.
Commissioner
yes.
Buck.
So I just want clarity on this. People who are sitting in the hospital right now who have no way to get home are calling EMS to get a ride home from the hospital?
So typically it would be part of the care plan that the hospital is putting together for the patient. If they are unable to identify any other way to discharge the patient, there are times when ambulance agencies, like I say, we're hearing this more in the rural communities, that they don't have taxis, they don't have easy access to any other type of transportation, they don't have reliable bus systems. So this is when EMS gets called or ambulance services gets called. It happens also if someone needs to make it from Oak Ridge to Eugene for medical care and they don't have any other way that they've identified to be able to get there. At times, ambulances are called to assist with those transports when folks are sick, injured, disabled, and don't have access to other transportation.
And that transport is non-reimbursable?
Correct. Unless it's to the emergency department.
So the hospital may arrange with an EMS provider to take somebody home, which I imagine, take some off other calls, other really important calls that they need to get to, and they provide no reimbursement to the fire districts.
That's my understanding from the conversations with the rural fire chiefs. Our ambulance agencies are very, very good about prioritizing their calls and making sure that they have resources for their priority 1 calls. So sometimes these types of non-emergent transports get delayed, but it is a service that is needed for the community. And again, ambulance agencies have become a medical safety net because of all of the other gaps that we have in our systems.
So we know that our EMS services want to do everything that they can. So they're going to go to every call, do every request, if they're at all possible to do it. But as we see the contraction of funding for these ASA service districts, they're going to start telling us, as they have, that they're not going to be able to do certain calls.
That's right.
I can see in this case, this is a potential area in which they would be able to say, I'm sorry, we're not going to be able to provide that kind of service anymore. And patients remain either in the hospital with no way to get home, taking up longer time in those bed spaces than otherwise would be necessary, or people are going to call in the rural areas largely for these transport services to maybe places that are not the emergency room, and they're not going to get a response because those agencies are no longer able to provide that service because they don't get reimbursed for it. And their costs are going up like everybody else. Hence, additionally clogging the system at the hospital, with bed stays, but also with patients, potential patients at home, unable to get into town to whatever appointment they need for their medical care. Is there anything in this space that can take up that kind of service and free up our EMS services?
That's one of the things that we're talking about in the operations subcommittee. And so many people will be familiar with RideSource, which is run by Lane Transit District. It is difficult to get immediate response from RideSource. That's not what they're intended to do. But some of our conversations are, well, gosh, if everybody chipped in to help fund some sort of immediate response program for whether it be RideSource or whether it be another similar agency, would that help to provide more efficient service to our community? So what I want for the public to hear is that we're really digging in with the fire chiefs to say, what is inefficient about our system today? How could we reorganize and propose a system that does a better job? There are some real structural barriers that we're not going to be able to address on the operations side, but there are some things that may be able to make us more efficient before we start talking about asking the community for more money for these services. So that's really what the operations committee is focused on. This topic of non-emergency transport was a big one in our first operations committee meeting and what we could do to address that need in a better way.
And we do know that, when EMS comes out to a call, is able to stabilize somebody, but doesn't transport them to the emergency department, they're not getting paid for that service. That is not a local rule of any kind. That is a reimbursement through the federal government that limits that type of funding. Is that right?
We need to suss out a little bit how much of this is state and how much of this is federal. And what could the state potentially request in a waiver, for example, would they have to request a Medicaid waiver in order to pay for other types of alternative transport through Medicaid funds? So when we're with Medicare, that is always going to be governed fully by the federal government, and that is something that we have less control over. Medicaid is sometimes something where we can work with the federal government, but there would have to be action taken between the state and federal level to be able to adjust what Medicaid and Medicare dollars could be utilized utilized for in terms of reimbursement.
Very complicated.
We don't make a simple system. So all that I have here is just to let you know that our subcommittee meetings are going to continue. Then we will pull everybody back together and hopefully coalesce on are there operational changes that we could make with the resources that we have in order to make EMS more efficient today? And then what are some policy considerations that we might bring to our state partners in particular? And then where are the gaps that remain after all of that work? So I initially asked you for 18 months. I do think this is going to take longer than 18 months to really do this well. You know, when I look at the length of time in the Public Safety Funding Task Force, there's just a lot of work that goes into this to make sure that we are spending the dollars that we have as efficiently as possible. We're addressing anything that we can address before we would say, and now we still have a gap that we need to figure out how to solve and come up with solutions for that. Unless there are any objections, I think we probably will go beyond 18 months, but I'll continue to come back giving you updates.
Commissioner Trigger?
Yeah, just a quick question. How many entities are involved in this work currently? How many different ASAs? And
I believe it is 6, including the county.
Thank you.
That is not all of our ASA holders, but it's all of our major ones.
Okay, to the board, do we have any questions? No, no questions? Sounds like we just have lots of work to do. Commissioner Farr.
Just a clarification, the task force is willing to put in extended work, and they've been pulled on that?
You know, there are always situations where we may have turnover, but I really think that the people who are on this task force are very committed to trying to make sure we have sustainability in ambulance services within Lane County. So certainly, if we were to see any changes in terms of ambulance providers in our community at any point, that may shake up the group. But at this point, we haven't seen that any of our members would be impacted by that.
No fatigue demonstrated. I suspected that. Thank you.
Okay. Well, I sure appreciate the report. Yeah, we've got our work cut out for you. So we'll be moving on to item 6C, a report on the Navigation Center for fiscal year 26-27. See James Ewell and Kate Budd on their way up. Perfect. Thanks, Eve.
Thank you. I'm just moving chairs.
Stay in the hot seat.
Okay, I can just do introductions here. I think you all know these folks, but for the sake of the public, Kate Budd, who is our Human Services Division Manager, and James Ewell, who is the Program Manager within our Homeless Services Program.
Good morning, Commissioners. Thanks for having us here today to present on the Navigation Center and some options for moving forward with that contract. Apologize in advance if I sneeze. My allergies are bad today. The pollen out there is rough, so apologies in advance. Oops. So I'll start by giving just a little bit of history, a reminder of the Navigation Center. I'm also going to speak to the request for proposal process and the funding timelines that have been in place since the Nav Center opened in 2022. And then I want to speak to what makes the Nav Center unique within our diverse shelter system. I'll provide you an update on the neighborhood relationships and conversations we've had since last summer when we had this conversation. And then we also recently did a participant feedback session at the Nav Center, and I want to share the results of that with you. And then in closing, we'll provide you with some options that we see for moving forward to give you the opportunity to decide how you would like to do that. So just as a reminder, the NAV Center was opened in September of 2022. It was a partnership with the City of Eugene through June 30 of 2024. That MOU ended at that point. It has been operated by Equitable Social Solutions, or ESS, from its opening. And it provides support for adults that need assistance with transitioning into safe and stable housing. It is currently the one shelter in our system that receives direct referrals from the centralized waiting list, which is comprised of folks that have done front door assessments and have been assessed as having the highest vulnerability in our community. And then it's a 75-bed congregate style shelter, and I'll get into the differences between congregate and non-congregate on an upcoming slide. So as we go back and look at kind of what has brought us here today, we have conducted 2 requests for proposals, or RFPs, for the NAV Center. The first one was in March of 2022, and there were 3 applicants that submitted proposals for that RFP. And the proposed budgets from the top 2 scorers were comparable. They were within about $75,000 of each other. I do want to note that, unlike goods or other services, RFPs for Health and Human Services programs generally aren't scored just on their budget. We're looking at a variety of factors, including, experience with operating such models and different factors in addition to the budget. After that RFP in the spring of 2022, ESS was awarded the NAV Center contract. We then went out for a second RFP in May of 2025. In that RFP, there were actually 4 applicants that submitted proposals, and all proposed budgets were higher than ESS's fiscal year 2026 contract. I say that because I think it's just important to note that other providers also saw what the cost of running a navigation center model is. And there were actually 2 of those applicants that had operated nav centers in other areas of our country. And so they were familiar with the cost associated of sheltering really highly vulnerable individuals. Ultimately, out of that May 2025 RFP process, ESS's contract was renewed. Jumping to the spring, later in the spring of 2025, so this was before we learned of the reduced state funding for shelter. Shelter providers that were awarded out of the RFP were initially funded based on what they requested. So they submitted budgets for their programs around what they needed, and then we funded them based on those requests. We then learned of the reduced state shelter funding that was going to affect all of the shelter providers in fiscal year 2026. At that point, as you may remember, we asked all shelter providers to reduce their budgets by 25 to 30% to help to get us to cover that gap in funding. After doing that reduction, still in the spring of 2026, hang on, I can't see the thing. There we go. In this current fiscal year, we, as I think has been shared, although we saw an increase in the state shelter allotment of just over $1 million, we had several other one-time funding sources that end after this current fiscal year. And so we still are going into next year having some reductions to the shelter funding and needing to continue with the reduced budgets that were proposed in fiscal year 25. So for these current fiscal year, or for the budgets going into fiscal year 2027, we continue to fund based on what the providers asked for and what they wanted. But that 25 to 30% reduction was still in place because of us not seeing an increase in the overall funding. So I use this kind of silly little graphic just to highlight the point that it's very difficult to compare shelters apples to apples. And that's for a variety of reasons that I'm going to get into in the next few slides. And really just highlighting that the NAV Center in particular is unique within our shelter system. So one of the primary differences, which I previously mentioned, is that the NAV Center currently is the only shelter in our system that receives direct referral from Lane County Coordinated Entry. And as I mentioned before, those are for folks that have scored 10 or higher on the front door assessment. And the front door assessment assesses for tri-morbidity and really is measuring the likelihood of death if someone were to remain unsheltered. So folks that have very high scores, which are considered 10 or higher, are considered to be the most vulnerable folks in our community. And so as you can see, the NAV Center serves a very high percentage of those highly vulnerable folks, only behind the Fuse shelter, which would make sense. I'm going to talk about Fuse in an upcoming slide, but Fuse population is also a very vulnerable population. I will note that we have other shelters, Everyone Village, for example, that has expressed interest in taking referrals and will take referrals. They just have not had turnover yet in their shelter bed, so have not taken any as of this time. But we look forward to them and other shelters starting to take referrals, so we can really then analyze on a little bit more of a apples to apples comparison if they're serving similar populations.
Chair, I have a question specific to this slide.
Yes, absolutely.
Thank you. Mr. Ewell, the slide, the 52%, 45%, that is 52 and 45% of the existing population in these facilities.
These are folks that were served this current fiscal year, so July 1st of 2025 up until I ran the data, which was May 19th. So it's not a point in time snapshot. It's just
the 52%, for instance, refers to as 52%. It's 52 out of every 100 people in that facility.
Correct.
At the point in time that this picture was taken.
Correct.
Thank you.
And so another factor we looked at was Fuse, which is the frequent users systems engagement. And Fuse folks are folks that are showing up within our community systems at higher levels. So the criteria that's used for Fuse is there below at the bottom of the slide. It's 7 or more arrests in the last 12 months, 4 or more jail bookings in the last 12 months, 12 or more emergency department visits in the last 12 months, or a combination of 10 or more of those in the last 12 months. It's important to talk about Fuse because there has been a lot of data, some of which I'll share shortly, that really shows that the cost of providing shelter and housing to Fuse folks is much cheaper for communities than it is to have them accessing the ER and inpatient care with the inability to pay those costs. So those are bills that are going unpaid. And then also just the cost of having folks go in and out of the jails for homelessness-related crime. There's just an inherent cost to the community. So on this slide, I want to make sure to differentiate that these are not percentages. These are individuals served. So going back to 2022, which is really the point that many of these shelters came onto our system, you'll see that the NAV Center is among the shelters that has sheltered the most Fuse folks in our system between 2022 and now. And again, why that's important is this data, which has been collected locally. We have not had an opportunity to update it since December of 2025, but as you can see, the bar graphs on the left show emergency department admits before someone was enrolled in a Fuse program. So before they were connected to those support services, whether it be shelter, case management, or housing, and then after. And then the right side is for inpatient admissions before and after. And as you can see, the cost dramatically decreases for folks once they get connected with Fuse. And again, those are costs that we see communities often are paying for those through just the unpaid medical bills, the cost of operating the jail, those types of things. So it's again just a metric that can be used to look at the vulnerability of the folks that are staying at the NAV Center, and then also some of the cost savings associated with sheltering a higher number of folks that meet the Fuse eligibility.
With apology, Chair, I have one quick question, and it's actually regarding the previous slide. The numbers on the previous slide are cumulative between 2022 and present, a little over 3 years.
That is correct. That is correct.
So, for instance, Duster Dawn has, in that period of time, served 83 individuals.
Correct.
On the, in the FUSE program.
That is correct.
And Brooklyn has served 5 over the course of that many years.
That is correct.
Thank you.
And the last metric we looked at was the percentage of participants who self-report having more than one disability. And as you can see, all of our shelters are serving a high percentage. More than half of the folks at all of our shelters are self-identifying with more than one disability. And the disabilities that we track within HMIS are mental health disorder, physical disability, chronic health condition, substance use disorder, developmental disability, and other. So again, the NAV Center is among the top of the shelter providers that are sheltering folks with more than one disability, which again is indicative of a very vulnerable population. So as we start to talk about just the differences between congregate and non-congregate considerations, so the NAV Center being a congregate shelter, non-congregate shelters are shelters where participants have access to their own space. So examples of that, the COVID hotel sheltering that we did early on in COVID, where we utilized the hotels on Franklin Boulevard, that would be an example of non-congregate. Some of our other village shelters that utilize Conestogas or pallets, those would be other examples of non-congregate. It's very important to just note that we recognize that offering multiple different types of shelter is incredibly important. We want to be able to meet the variety of needs that are seen within folks that are experiencing homelessness, and folks should have the opportunity to choose what type of shelter is going to work for them. So I'm certainly not advocating for one type of shelter versus another, but there are differences that come with each of those models. With congregate shelters versus non-congregate, we often see that participants with mobility issues need to be in fully accessible environments that are often those provided by congregate shelter. When you look at some of our non-congregate shelters that are generally more of like the Conestoga model or the pallet model, those are often on parcels of land that are difficult to access for folks with mobility issues. So whether it's folks in wheelchairs or in walkers, if it is a shelter that is on bumpy or rocky ground, that could be challenging for them to access that. We've also seen that folks that have pretty significant medical issues or reliance on medical equipment need the 24-hour support and staffing that is provided by congregate shelters because they need folks to be checking on them to ensure that their health issues are not worsening. And then also folks that need to use medical equipment that needs access to electricity, they really would need to be in a shelter that can provide that. And then I see I skipped one bullet here. Congregate shelters really do require having 24/7 staffing just due to the safety concerns that exist with group living and because of the incredibly high acuity levels that I previously mentioned. It just is not safe to operate a congregate shelter without that overnight staffing. And the difference, again, kind of going back to the ability of participants to be able to access their own locked space. Folks that are in non-congregate shelters that have locking doors, are able to be in those spaces overnight, whereas in congregate shelters, folks are in a shared living situation. So I also wanted to talk a little bit about lengths of stay and then cost per bed. We're going to talk towards the end of just a recognition that the cost per bed conversation is an important one to have. But I also want to make sure to touch on the nuance of cost per bed versus cost per person sheltered. So when we look at our congregate shelters versus our non-congregate shelters or our village model shelters, we're seeing a much longer average length of stay stay in our non-congregate shelters before folks are being exited to housing. So this is data from the current fiscal year. We are seeing that our congregate shelters, the average length of stay before a participant exits to housing is 131 days. And for our non-congregate shelters, it's 294 days. So because of that, there's just less turnover in those non-congregate shelters. Looking specifically at the NAV Center, in this current fiscal year, the NAV Center, they have a 75-bed capacity, but they've sheltered 187 people this fiscal year. So the cost per bed is really, instead of calculating their overall budget, dividing it by 75, you really want to look at how many folks have accessed that shelter. And so, they're seeing almost 2.5 folks per bed accessing this current fiscal year. And we're not seeing that with shelters that have longer lengths of stay. And again, that's just because of there not being as much turnover in those shelters. This graphic shows, these are all of our currently funded, state OHCS state-funded adult-only shelters for this current fiscal year. And again, you'll see there's, a wide spectrum of lengths of stay at our shelters. We do see the shelters on the right with the asterisks. Those are the shelters that are our village model shelters. They have longer stays than we're seeing in some of our other shelters. That could be because of just the model that they're using, that they really are working to engage people in a village type model that's really focused on them being a part of that community. And then we see with some of our other shelters, Dusted On, the NAV Center, that are, shelters that are not that same model, are having a quicker turnaround or a quicker, less average days of exit until housing. So again, it's just important to look at, there's so much nuance with all of this. It's important that when we start to talk about cost per bed, that we're really keeping in mind factors like this, which are nuanced, and really we need to look at it more as a cost per person sheltered versus cost per bed. So I want to give an update on the engagement both that ESS has done over the last year to continue those neighborhood partnerships, as well as things that the county staff, myself and Kate, have done to continue those conversations and to really broaden and strengthen them. So over the last year, Kate and I have had quarterly meetings with Eugene Police Department, the 4J superintendent, and North Eugene High School representatives. That has included the North Eugene High School principal, the head of their security, and then a couple different parents from the parent group there at the high school. All of those entities have noted that there have been improvements in neighborhood issues since last year. I think there's some different reasons for that. There has been a new fence that was installed behind the building of the NAV Center that limited the ability of non-NAV Center folks to come in and out of that area. And it had really been identified by EPD as a high traffic area for drug-related crime and other crime that was happening with folks that are not NAV Center participants. EPD and Lieutenant Sullivan in particular really has made it clear that EPD is not seeing NAV Center participants as being the folks that are committing the crime in the area. Additionally, in addition to that fence, the Sheriff's Department had worked to close a business in that area that had been a front for drug dealing. That has been closed now, I believe, 8 to 9 months, and EPD and the Sheriff's Department have really identified that as being something that has reduced the overall drug traffic in that neighborhood, in that area. I did want to talk a little bit about barbed wire that I heard was mentioned in public comment. The barbed wire has been put up by a surrounding business, the Dollar Tree business. ESS has really worked with the other businesses in the area to encourage them to work to address their security on their property, particularly in overnight times, because we were hearing repeatedly from EPD that those areas needed needed to have things like better lighting, needed to have security if at all possible, 24-hour like in-person security if at all possible, because there was just a lot of crime activity happening in the broader neighborhood. And so it sounds like the Dollar Tree chose to put up barbed wire on that back fence area. I think their intent was to further limit the non-NAV Center participant traffic that was coming in and out of that area. In addition to the meetings that we've had with the school district and with the EPD, the NAV Center continues to have quarterly meetings with the two community neighborhood associations in the area, have invited all business owners that are within close proximity, have not had huge turnout from those groups, but I go to those meetings and have seen several business owners come and be actively a part of those, and it's just been a great way for those business owners and those community neighbors to express concerns and to really work with ESS to address them. They also had an open house event a few weeks ago, which gave an opportunity for folks in the community to really come inside and see what it looks like inside. I think there have been just misconceptions. You can't fully grasp what is happening inside the NAV Center just by looking at the outside. So it was a good opportunity to engage with neighbors and other community partners. And then I did want to highlight the number of folks at the NAV Center that are connected to treatment. Whether that be substance abuse treatment or mental health treatment. So this is a point in time count. So currently almost half, or 37 individuals at the NAV Center are currently receiving individual treatment, either from Willamette Valley Behavioral Health or the Coquel Wellness Centers. And they are providing that individual treatment there on site at the NAV Center. So they're bringing those services to those residents and have really seen success, especially in the last year. It takes time to build relationships with folks to connect them to treatment, and the NAV Center has really seen that these entities have been great at doing that. And then additionally, there are weekly on-site substance abuse treatment groups put on by Emergence, and they're averaging about 10 participants per week that they're seeing at those substance abuse groups. So it's just important. I know, and I've heard the narrative sometimes that folks don't think that the NAV Center participants are engaging in treatment of any kind, and as we can see, that just is not accurate. Almost half of them are engaged in some form of treatment. And additionally, this is just the numbers of the treatment that is occurring there on site. Was not able to pull data, but there are obviously folks that are accessing treatment outside of the providers that are listed here on this slide. So moving to the participant feedback session, just a little bit of background. Our Lived Experience Advisory Group, LEAGUE, that I know you are familiar with, every year does participant feedback sessions tries to do it with all of the providers that we're contracted with. And it's really a way to hear directly from the folks that are being provided services, what their thoughts are on those services. And I will say, having reviewed many of these over the 5-ish years that I've been here, they give very honest feedback and very direct feedback. And so it's been a good way to kind of get a pulse of how a project is operating. And so in early April, the League folks went and did a participant feedback session at the NAV Center. And they were provided both an anonymous survey to fill out, and then there was also just a conversation that was facilitated by League members as well as a county staff. And so as you can see, the average scores on these survey questions were high. They were all above agree, which is a positive for all of these questions. And so we see that the NAV Center participants who participated in this survey really feel like the NAV Center is working with them to identify goals and to then accomplish those goals. They have staff that care about them and are actively engaging them. They feel like they're treated with respect and compassion. And I think most importantly for me, one of the most important things is that the majority of folks really feel safe staying at the NAV Center, which is not to say folks at other shelters don't feel safe, but I think that at times there's been feedback or input from folks that the NAV Center is a dangerous place, and that's not what we're hearing from the participants directly. And I'm not going to read all of these, but I did want to share some of the, and these are verbatim comments that came from participants that were participating in the focus group. And again, it really just highlights, that the NAV Center is working directly with folks to connect them to permanency. So whether that's helping, like this first person, helping them with getting a job, I know other folks they're working with to get connected to disability because they are seeing such a high percentage of folks that have multiple disabilities. And then just the connections that folks are making with staff, with the folks that are coming into the building from other areas. And I did also want to note, both through this feedback process, but then also in conversations I've had recently with NAV Center staff and participants, they are hearing about meetings like this and are seeing media stories about the NAV Center and hearing, that potentially the NAV Center is going to close, and it's causing them quite a bit of anxiety. And this last quote here, is someone that really obviously has seen some of those stories. And also the second to last one where, folks are hearing about narratives that are being said about the NAV Center, and they're experiencing it differently being a participant. So I just highlight that because I think it's important in all of these conversations to remember the human beings that are in these facilities and are accessing services. So as a part of this conversation, it's really brought up some important topics that we are very much interested in exploring as we move forward with how future shelter funding considerations and determinations are made. One of which I've already mentioned is the cost per shelter bed threshold. That is a topic that is being discussed at the state level as well. They have recommended for not this coming fiscal year, but for fiscal year 28, I believe. A $31,000 per bed max. That's significantly more than most of the shelter beds in our community. And we're actually on the lower end of some of the other regions of the state. So the larger, like Portland metropolitan areas have a much higher per bed cost than we do. So I say that just because, there may be an opportunity for Lane County to discuss those costs per shelter bed thresholds ourselves, and that conversation is going to happen on a state level. I do hope, going back to what I shared earlier, that when those conversations happen, we're looking at things like cost per person sheltered, not just cost per bed. It's also going to be important to look at how and why those costs are determined. The level of acuity at a shelter is one factor that may lead to an increased cost. 24/7 staffing is another one. Again, as I mentioned, congregate shelters generally, and more specifically a congregate shelter like the NAV Center that serves a very high acuity population, they have to have 24/7 staffing. Not all of our shelters in our system have that staffing, 24/7 staffing. So there's obviously a increased cost associated with that. It's also important to look at ensuring that all providers that are contracting with us are able to provide their staff benefits as well as a living wage. And that's not something that we are currently seeing. And so we really would want to work, whether that be through the commissioners working to look at procurement-related policies or guidelines, ensuring that we are only contracting with entities that are providing benefits, or if there's another way for that conversation to happen. We certainly recognize that that's critical to the wellness of our shelter providers. And then I know the commissioners have already had this discussion to some degree, but does Lane County want to create a local provider preference? They're, as a part of this larger NAV Center conversations, that's something that has come up, is that ESS is a provider that is not directly from Lane County. I will say that all of the staff that work at the NAV Center are Lane County employees and Lane County residents, but they're headquartered members are not based here in Lane County. It's also important to note that coming up again in fiscal year 28, the state is likely to ask communities to have a local funding contribution or match to the state funding. So if that ends up being the case, and depending on what that percentage is, I think right now they're saying 20%, yeah. Our community is going to need to look to see how we can come up with that match. And then, along with that, kind of the elephant in the room is we don't know what the funding for shelter is going to be in fiscal year 28. That'll come from the state legislative process. So there is the potential, I think a lot of folks are forecasting, that we are likely to see a reduction again in shelter funding as we move into fiscal year 28. So all of that to be said, there's just a lot of really important conversations that need to happen that have come from this discussion and we feel are really important to have, and they are going to take some time to be able to have them. So in closing, moving into just providing some options for moving forward, we have talked with county contracting and procurement staff. We have talked with county council, and we feel these are the three options that are available to you all to decide regarding how to move forward. And I'll go into a little bit more in depth in each of them, but the first would be to renew ESS's contract for 1 year, so for the upcoming fiscal year, July 1st, 2026 to June 30th, 2027. And then we would issue a new shelter RFP likely in 6-ish months, as we would want to ensure enough time to be able to create the RFP and then have it out and ready so that folks could apply as we look to the fiscal year starting in July 1 of 27. Second option would be to not renew the ESS contract and to close the navigation center. And then the third option would be to continue as is. So that would be renewing ESS's contract for 1 year. And then our current shelter RFP is actually valid until June 30th of 2028. So in that third option, what differentiates it from the first one is there would be an option to renew the Nav Center contract for a second fiscal year. Based on the current RFP being valid until 2028. So in looking at these a little bit more in depth, again, with the first option, which would be renewing the contract for this upcoming year, doing this would allow for a longer transition time versus obviously just closing the Nav Center. And it would allow, time to be really thoughtful and intentional in addressing those factors that I mentioned on the previous slide. I will note that doing an RFP, a new shelter RFP earlier than we have to could potentially cause a disruption to our broader shelter system because that RFP would be for all the shelters in our system. It would not just be for the Nav Center. But again, this would be our recommendation. We really feel like it gives us that time to work on those shelter funding considerations and also allows for really thoughtful planning over the next year as we move to potentially a different provider.
Excuse me, James. Commissioner Trigger.
Did you say if we do a 6-month, then everybody has to reset to that same timeline? Why is that?
We would, our interest would be in issuing a new shelter RFP for all shelters so that we're on the same cadence with all of them. And we would need to know what the shelter funding is going to be for that upcoming year to be able to plan more broadly for the whole system.
And I assume there's cost associating with issuing an RFP. There's staff time in crafting it, reviewing the proposals, scoring them, and so on. So it's...
Yeah, there's definitely staff time involved, and I would also say there's a burden on the provider. I mean, it's not an easy process to submit a proposal for an RFP by any means.
Thank you.
So moving to the second option, this would be not renewing ESS's contract and closing the navigation center. In our conversations with contracts and procurement team folks, it wouldn't just be the door gets shut tomorrow. There would need to be a transition period. The recommendation would be at least 90 days to ensure the contractual obligations, and then also there would be a need, obviously, of transferring those 75 residents, doing all we can to transfer those 75 residents to other shelters. Along with this option, it's important to mention that we would need to pay back, we being Lane County, would need to pay back $1.5 million to HUD with local funds. This is because of the funds that were used initially to rehab and renovate the building, to create it, to make it into a shelter. There's a restrictive covenant that's associated with that requires that building be utilized as an emergency shelter for 10 years. We have not reached that 10 years. So if we were to close that building and not have a shelter there, then there would be a cost return associated. Additionally, another thing to consider, obviously, is that there would be 75 incredibly highly vulnerable individuals that would return to the streets if that shelter were to close. Additionally, ESS currently has 18 full-time employees that would be laid off if that program were to close. I do also believe that, just going back to the second bullet point, if the NAV Center were to close and those folks were to end up back on the street, it likely would lead to an increase in unsheltered homelessness in that area in general, because folks likely have, made connections with local grocery stores or nowhere to go to get their laundry or whatever, and likely would continue to probably feel safest in that area. So, this would not be an option that we would recommend moving forward with, just because of the negative effects that would come of it. And then the third option is basically continuing as is. So it would be renewing their contract for a one-year basis, and then they would have the potential to renew again at the end of the next fiscal year, because the current RFP would still be valid. We would then issue that new RFP in the spring of 2028. Doing this, continuing as is, obviously would not result in a disruption of services. ESS would continue to operate the NAV Center as they have been operating. I meant to mention this earlier. I think it's important to note that ESS has met or exceeded all of the outcomes that we have asked of them for the NAV Center. And so we have a provider that we know can perform in the way that we want them to perform. And so, if there were to be a change in provider, someone who has not operated the NAV Center before, time would tell, their performance. And with ESS, we know that we are getting a highly high-performing provider. Having an potentially additional second year would just give us more time to explore those future shelter considerations, recognizing that they are lofty, and that some of those, a lot of information will be coming down from the state that may influence our local decision making. And then I do want to say, I recognize that this option would not quell the community concerns that I know you all hear, that I hear, that my team hears, that ESS hears, that their participants hear, and that continuing on for 2 years may not be the option that is going to, help to calm some of those concerns that exist out there. But we really feel like, because of the RFP process, that the time that would be needed to help craft the RFP process, that first option is really the one that we would recommend, because it gives us that adequate amount of time, but also a recognition that there is a lot of pressure that has been put on this project, and then it has been brought up by the community. So those are the options we present to you, and happy to answer any questions that exist.
Yes, Vice Chair.
Thank you. Thank you. That was a lot of very good information. I appreciate it. I specifically want to talk just a little bit about the type of data that we collect. You have noted cost per beds, and other providers and Oregon Housing Community Services have often utilized a cost per bed as a metric. And what you've mentioned and what you've displayed is that metric may not be the ideal metric. Very much like we had the point in time count for so long, but we know that the homeless by name count is far superior to that. and provides a lot more quality data. Your suggestion is that the cost per person served is a very important metric, which is very different than the cost per bed. And when you had up here the slide on how long people are in the community, it was clear that the NAV Center served twice as many people as, say, Everyone's Village or some others that have a different type of shelter model. For me, that begs the question, are we utilizing the right metric to analyze the type of services that we're funding and the community is providing, knowing that that is not the only metric necessarily that needs to be considered. But if you're trying to say, you know, one provider has a cost per bed of X, Y, and Z, and another provider is half that cost, that is not giving us all the data and information, at least quality metric, to analyze them apples to apples, because they're very different. We know that we have providers that have different specialties, different populations that they serve, different models of housing, all of which do wonderful work in our community. But I'm actually quite interested in really knowing the correct method from a fiscal point of view that we should be analyzing instead of the cost per bed. And if it's the cost per person served, is that not something that Oregon Housing and Community Services should also be reviewing and viewing when they're doling out funding for this kind of services? And how do we get that information so that from a fiscal standpoint, we are then able to really review, maybe not completely apples to apples, but much closer? And so how can we utilize that better?
Yeah, I think it's a good question, and I'll probably default to Kate here in a second, but I think that's also just part of why we need the time to dig into all of this, because it's complex and it's nuanced, and you know, there are just so many factors that are at play when you're looking at cost per bed that it just would take a lot of time to do that. Kate is more connected with, I think, the OHC conversation than I am, though.
And I'll just suggest that I think you touched on the fact that there isn't just one way to determine, you know, how to fund a program, and that there's a lot that goes into it. And so looking at different data points is really important to get that full 360-degree view. The state, I'll frankly offer, is behind when it comes to collecting data related to shelters or, you know, other HMIS data, in that they, you know, are still really building their infrastructure in order to do that. And so even getting to the point where they've been able to collect and share what the average cost per bed is across communities is monumental for them. And so should they continue to look at other perspectives, I think it will take a great deal of time in that they would need to literally collect that across the state. I will also offer that my understanding as to why the state looked at cost per bed is that there was a budget note from the last legislative session that they ought to do that. And so, you know, maybe in the next legislative session, they would get direction to look at other aspects of emergency shelter. What really came out of the state's view regarding the cost per bed, for example, is as James mentioned, that we have a very low cost per bed on average as a community, period. Especially when compared to the other larger regions across our state. And so I think that is notable, and that our, you know, providers are very efficient in the services that they provide. And we want to make sure that they are able to provide kind of the minimum, services, not only to their staff, but also to the clients, that would make not only a strong nonprofit, but also a strong shelter for those within their community. And so, again, looking at various different data points is important to be able to make sure that the full picture is being considered.
I think one other thing that we could potentially look at as, we are uniquely positioned in this community, and in that we have a university right down the street. And we do have a data science program there, and they are interested in partnership opportunities. And so maybe this is something that we can have further conversation around, because it really is going to take a mathematician, statistician, someone who could help us with weighting these different factors to understand, because it's not just about cost per person or cost per bed. It's also about what are the needs of the people that you're serving, and also what is the benefit to the community in terms of reduced costs elsewhere in our system that these different shelters are contributing to. And so there are so many, and I think James did a phenomenal job of showing kind of all the different slices of how you can look at these data, but to put it together into one model that actually predicts what should this bed cost, given the people served, the model, and the service to the community. I think we don't have, I don't know that nationally there's a metric around that. So, but, why not start with a partnership somewhere, or try to look into how do we dig into this a little bit further, and maybe we again can be a model for the state on how to think about these things.
Well, I think one thing that would help me is seeing the funding that goes to the different shelters on this sheet, because it's hard to correlate beds and number of stays, and I'm sitting there. We've brought up everyone's shelter a couple of times. Probably has nothing to do with Gabe being in here, but it, we get 100 days more out of someone staying at everyone's shelter. Well, of course, that's where you'd rather stay. I mean, you've got your own tiny home versus a bunk bed. So, the more comfortable you make these places, I think we're going to get longer stays. And I don't know that that's necessarily a bad thing. Commissioner Farr.
Thank you. And we've been debating this since I joined service back in 1991, and the evolution is tremendous, and the pipeline has grown, and we've been unable to stem the flow through the pipeline. Everybody acknowledges that. But I really wanted, James, thank you for this, and both James and Kate and Director Gray and Assistant Director Inman for wonderful presentation. Anybody who wants to see this is online. They can see every single slide on this. Is a great deal of data to be analyzed, to be looked at, to be thought about. Can't do that all this morning, so I'm going to go directly to the question at hand, and that is the three options that we have in front of us.
Put the three slide up, sorry, Commissioner.
Turn all three.
Great, thank you.
So I want to also thank you, both Kate and Eve, for being participants in the LGAC, where we work directly with OHA and OHCS on housing issues, and we talk to the directors and help them shape their what has always been kind of an impenetrable system. You're making it more penetrable by being there, by telling them how their actions are actually causing our effects on the ground. And last Friday, we had a very good meeting up there, a good presentation by Liz Weber from OHCS. A lot of good information. Let's not analyze that this morning. Let's talk specifically about what is today's question. Charlie Rojas this morning asked me, didn't ask these guys, he asked me if I knew about the triple concertina barbed wire around Dollar Tree. No, I didn't. I see it all over town. I've not seen it there. But why did he ask me specifically? He didn't ask anybody else. He didn't ask you. He asked me. Well, I've got an answer to that. We're all this is all our wheelhouse. We're all in the same wheelhouse, but I've been in this wheelhouse longer. Both in Bethel and in River Road, and I've seen the effects of time in Bethel and in River Road and in Southwest Eugene. And the pipeline has grown bigger, More people are entering the pipeline, and I'm not going to apologize for our inability to address that. Everybody from Seattle to Los Angeles to San Diego has an inability to address the pipeline. It's a matter of housing, it's a matter of behavioral health treatment, it's a matter of drug use, all things that are somewhat beyond our control, certainly beyond our absolute control. So we're here today, here at this point in time, with the pipeline unalterable. But how do we respond to that pipeline? Now, from my perspective, right now you're asking us, do we renew the contract with a new RFP or the other two options? From my perspective, we've seen a significant evolution in both the service model and facility adaptation from providers in Lane County. And the providers include Everyone Village, it includes Reveille, it includes Ideal Option, and it includes our deflection program. And over the last year, lots happened. My gosh, if you drive down Highway 99 and talk to any member of the Gilbert family who've lived there since before I did, and I've been there half a century, they'll say, what has happened here on Highway 99? Why is this looking like this the way it is today? Well, it's because of this pipeline. And it's not just in River Road surrounding the Navigation Center, and it's not just in Bethel surrounding Dusk to Dawn and other programs that we have in Bethel. It's all over. It's in Providence, Rhode Island. It's everywhere. So not to make excuses for that, but we are here in Lane County, here in Eugene, and we have a number of different services that can provide wonderful results. If anybody has questions about the effectiveness of the foresight and the results of Everyone's Village, I'm going to take them on a personal tour with permission of Gabe, and I'll show them what's happening there. It's amazing what is happening there for about this much compared to what government spends, for a very small amount of money. If anybody questions the effectiveness of Reveille Foundation and the work that they're doing both with our deflection program and with veterans in general, I'll take them on a tour and I'll show them. There's no question here. They're doing a fantastic job on a dime. If anybody has questions about Ideal Option, I'll take them on a tour and show them what they're doing. If anybody has questions about our deflection program, I'll show them all of those things. All of these things are positive things, and over the course of the last year, all of these have evolved to a point in time right now where they really are providing a higher level of service and a more effective model than each one of those was providing a year ago. And it's marvelous to see that. So here we are at this point in time, and we have a choice before us. Do we renew the ESS contract for a year and extend it through 2028 or continue it through 2028, or do we look at something different? Well, I believe a year ago we couldn't have looked at something different because we didn't have the exact same picture that we have today. Today we have a better picture, a clearer picture. A year from now it'll be clearer yet, I'm sure, but we can't wait another year. My leaning is toward renewing the ESS contract for 1 year and issue a new RFP for the contract to start in 7/1/21. Now, we're looking at issuing the new RFP sometime in February, March, whenever it may be. I'd like to hasten that as much as possible to start getting the elements of what may be going into the RFP and program. And we have a great deal of insight, a great deal of information from Gabe and from Clint and from John and from all of the people who are providing tremendous services about how can we get the Navigation Center to the highest and best use in that particular location. That's what we need to look at. So I'd like to, and I've talked to Kachina about this, I've talked to you all about this, about how do we aggressively in the next year, by the end of this, the coming year, have something in place that really does take advantage of all of the wonderful, remarkable, mind-boggling services that are happening. If you drive out to Everyone Village, you'll be, if you've not been there in 6 months, you'll be awed at what you see out there. Absolutely. People who are coming through the system and coming out at the end of it better than they went in, far better than they went in, and with steps along the way. Nobody disagrees with that. So what I would like to see is a very aggressive look at what is going to go into the new RFP, and what do we ask for when the time comes to issue the RFP, and what are we going to expect in return? Now, I have a couple of questions surrounding that, but you don't need to answer this right now. But as we put out this new RFP, is it possible, in your estimation, with that one facility that we have, to have multiple providers inside that same facility providing different types of service? Now, Kate, you and I have talked about the diversity of options for shelter. We've got to have that because of the diversity of the people who are in shelter. And don't need to go into details on that, but is it possible to have multiple providers inside the same facility? Certainly not in a great room concept the way we more or less have out there, but in, divide it up a little bit more. That's one question that I have. Another question is, how frequently are people evicted from the navigation center compared to how frequently are people evicted from Reveille, for instance? I know the answers to this more or less, but it's going to be interesting to get those numbers in place, because eviction, once somebody is evicted, where do they go? Okay, you're out of the navigation center, where do you go? You're out of Reveille, where do you go? Well, let's not answer that here today, but the answer is, if you ask the Gilbert family, they hang around the Gilbert Center on Highway 99. If you ask the people who live on River Road, they hang around the business facility right there on River Road. It's wherever they go and wherever they have been. So I'm not going to go into too much detail there, but my bias on this is to option number one, but make it more aggressive. Get in place a really aggressive set of questions for people to begin to answer, so that by the time we get to the end of this year, we have something that's far more concrete than we're looking at today, far more effective than we're looking at today, and far more diverse than we have in place today. Thanks.
Thank you. Commissioner Lovell?
Thank you, Chair. I appreciate your words, Commissioner Farr. Thank you. It encapsulated a lot of my thoughts and a lot of my questions. And I certainly don't want to be here being the naysayer for 75 people who need services that we provide. I'm here to also address the needs of the community and to balance that argument as well. I agree with an aggressive approach. I think choice two, to close the center, could be adapted to maybe we do something more aggressive than what we thought imagined. I mean, let's face it, this is a messy situation, and sometimes messy situations require some messy solutions to get better. And I think we're kind of at that juncture right now. I've got to confess, I'm a little disappointed. I thought that after our December 9th meeting, after we had instructed and put out some guidance about what the board had head nods to do, that we would be at this place where we're at now months ago, probably within February of this year, deciding about an RFP to get to a decision today so that we could make a change. That was my hope as board chair last year, to get that. And I'm disappointed we're not there. So I'm just going to put that out there, because now we're going to punt this down the road another year. And so we're going to have, years worth of emails from the community, some disservices, some damages, some broken windows. The businesses are going to move out. I mean, the collateral damage to that, I think, is more extensive than we're laying claim to. So that's why I'm disappointed. So the questions that I want to ask are from the constituents' point of view is, what stage are we at? We're not at the stage where we're developing an RFP, because apparently we dropped the ball on that after December 9th. So, and we're not looking at trying to fund this with any kinds of apples to apples comparison, because we're trying to determine if the state funding model per bed is the same model we're going to use going forward. But the fact remains is that we have some discussion around this, how it functions. And so the question I have firstly is do all the housing programs do front door assessments? I noticed that one slide you had up there, James, was a comparison, let's say, to Everyone Village and to the Navigational Center, that there was this stark comparison about front door assessments. To my knowledge, Everyone Village doesn't do front door assessment when people come in. They just take them. They take them, they work with them, they hit them where they're at, and they create a path of success for them. So I think that comparison to the public is maybe an unfair comparison, or not an accurate comparison. I think the survey too, if I'm going to challenge the survey, we claim to have 187 people that have come out of this program, but we surveyed 10. I think that's a little anemic as far as pulling data from that, so that concerns me. And then the other thing is the security model that tends to ebb and flow with the Nav Center. When I was over there visiting, man, it was crystal polished and Navy, what I'd call Navy spick and span. And a week later, it's different. Then somebody comes to visit, it gets clean again. And a week later, there's cars that are being disrepaired in the parking lot. And so that ebb and flow, consistency concerns me as well. The other thing is the amount of people that the Navigational Center says puts into permanent housing. How many of those percentages of people succeed? We don't know. We don't know the recidivism behind that. And so that data is also lacking in the decision. So if I was to just put out a feeling of what I would like to do, as Commissioner Farr said, the success of the deflection, Reveille, other agencies, I would almost be inclined to give a 90-day notice to ESS and put those agencies, the deflection under Clint Riley's direction, Gabe Pahovich under Everyone's Village, and give them a shot for 6 months while we do an RFP process, including them in the RFP process. But I think we need a turnabout of events, because I just don't think another year is going to bear well with the community. So I would support a different plan moving forward than just what the three is up there, a modified plan, because at this point in the game, I don't support any of them. So thank you.
Thank you. I can certainly let James speak to any additional data points that we have in terms of the concerns that you brought forward. I might defer to County Council on whether it would be an option for us to non-competitively award a temporary contract to run the stabilization center, you can see what I spend most of my time on, the navigation center. When we have an RFP winning contract holder who's currently running that site, and whether there would be something legally that we could do in the interim.
Well, thankfully, we have our contract counsel right next to me, so watch this.
That is a difficult question. We have contractual obligations currently. So we would need to do a contract analysis on our current active contract. And then we would need to balance our contractual obligations with the procurement laws. I know there is an executive order by the governor that allows for emergency procurement, bypassing the procurement laws related to engaging in contractual services. So this is a nuanced answer to that question, and I am happy to provide additional information, but I am hesitant to provide a definitive in the meeting right now.
Commissioner Lovell.
Chair, thank you for that, Council Emily. I'm just wondering if that 90-day period would be an opportunity for council to have those answers.
90 days to provide an answer?
Well, if we give, we have to give contractually, as I understand it, ESS a 90-day transition signal if we're going to change providers. Does that 90-day period give you, the Council for Contracts, and the emergency procurement idea that you had just flagged, does that give us enough time to get that in place?
Thank you, Commissioner Lovell. I need to analyze that and get back to you to have a definitive answer for that.
Thank you.
And then I can speak just to the piece about the returns to homelessness. I don't have the data here present with me. I'm happy to run it, but we do track that. It's basically tracked through HMIS, the Homeless Management Information System. So when someone exits any of our programs, we look to see whether they return to HMIS in 6-month or 12-month increments. And so we can certainly look and see, when folks are coming back into the system, which granted, if they leave the area, then they may not be captured. But our HMIS system is incredibly robust. That's why we've been able to use it for the PIT count each year. And so I'm very confident that it's an accurate reflection of returns to homelessness. So would be happy to provide that data.
I think the only other contextual piece that I'll add here is that on the deflection side of the programming, because it is run by law enforcement, people are compelled to participate in the way that they are participating. And if they do not participate, they end up in jail or with charges or negative consequences. And because on the Health and Human Services side, there is no mechanism to compel someone to engage in certain behaviors, our ability to lead to some of those outcomes that happen when someone is compelled by the criminal justice system may not be, again, apples to apples. So I think that's something that we should consider in terms of looking at certain programs that are successful in some ways. Certainly, there are people who are turning their lives around, and it is because they are compelled. And there are people who are not successful in those programs. And then the consequences occur. But for the population of folks who are not criminally involved at this time or don't qualify for the deflection program, there's still a question in my mind about kind of how we manage that, and would we see the same outcomes?
Commissioner Trigger.
Thank you. Thank you, Chair. Thank you for the presentation. This is a really rich and important topic. It's why we have y'all coming to us quarterly. I think there might be some more opportunity to dig into some of the issues raised by the presentation. But before I say things particular to the conversation, I also just want to pull us up to a 10,000-foot level and remind us we are talking about a shelter system, and shelter is not housing. The housing conversation is a different conversation. They are interrelated. And so we're talking about a shelter system, which of course always the goal is to keep people alive and safe and supported until they are ready and there is housing available for them. So I just want to make sure we're remembering that. We are not solving the homelessness problem with our shelter system. We are keeping people alive and cared for until there is housing for them and they can succeed in that housing. And that's why we have lots of different models of housing, because not everybody succeeds in the same kind. And that's why we have lots of different models for shelter. And I really do not want this conversation to become a referendum on a particular model of shelter or a particular provider. It's not appropriate, and it's not helpful. Because the fact that different shelter models have a different turnover rate, if you will, both influx and out, is the strength of the system. It's because they're all different models, because different people have different needs at different times in their lives. So I just don't think that is a useful place to go. That is, in large measure, what the Human Services Commission wrestles with, the Poverty and Homelessness Board looks at, the RFP process and evaluation of responses looks at. It's not what this conversation, to me, I keep asking myself, what is the problem we're trying to solve for? And when I look at these three options before us, it's not even a problem. We're just making a decision. We are contractually obligated with an organization that is performing at and sometimes exceeding what we've asked of them to do under that contract. And we're asking, do we want to renew that for one more year or stay with what is currently in place, as I understand it, which is 2 more years, essentially? That is, in a nutshell, what we're being asked to decide. And so for me, 2 is off the table. And that is largely also because we are talking about people. And I don't see, when we talk about the anxiety of the residents and the impact on the residents, why we're even entertaining that conversation. To the point of community speaking out about the program, we've also received a couple of dozen emails in the last week supporting the program and ensuring that we keep its doors open. I think it's really important that we are starting to discuss this bed nights versus bed counts, people served versus number of beds. We went through this, 2 of my colleagues here, Commissioner Buck and Commissioner Farr, when we started initially, and I was on the Budget Committee the first time, we went out for a jail levy. And it was about jail beds. And people would take the number of dollars that would come in on the levy a year and divide that by the number of jail beds and say, that's too expensive. Well, because we're not paying per bed, we're paying per night or utilization of the bed. It's a different kind of math, and it's really important that we all understand it and dig into it. But again, that is not the problem we're trying to solve for today. So for me, number 2 is off the table. I would support number 3, but I would not block support for number 1 if that is the will of the board. My only question there is, would ESS be eligible to apply again in 1 year? That's part A.
Yes.
Great. When ESS was awarded the contract, we had 4 respondents, is that right?
In the most recent RFP, the original RFP, there was 3.
Okay, so we grew from 3 to 4 last time, and ESS won it both times. That's that. Yeah, I think that's really all I need to say is I'm just really focused on what problem are we trying to solve or what is the decision. And it's an existing contract, and this within the terms of the contract, we can decide to renew it just for 1 year and go out for RFP. That's within the terms of the contract. Is that right, Council? the contract doesn't require any adaptations to go with option one?
I don't have the contract in front of me, but I don't recall specifically, but if it is eligible for renewal, we can renew it. It is also within our discretion, as contracting parties, we can then choose to renew the contract based off of the RFP that we put out and the information within the RFP.
Great, thank you. Then, as I said, if I thought there was majority consensus on 3, I would fully support it. Seems like there may not be, so I would support 1 if there was a motion to do that. Number 2 is absolutely off the table for me. Thank you. Thank you, Chair.
Thank you. The board?
You got around, Chair?
Well, I've kind of chimed in when I felt needed, but.
I've got one more question, if you don't mind.
Yes, please.
Yeah, thank you, Chair. The NAB Center is right now about well, we're talking beds, it's about $2,588 a bed that we're seeing. As a person who has rentals, that's enough for anything we have to rent an apartment anywhere in the area. So that cost concerns me. And so the thing that compels us, you asked that too, Director Gray, you said what compels Lane County? What compels Lane County, I would hope, from a family who has suffered through this system is that I would hope we want to treat humans humanely. I would hope that what compels us to go forward is that we would look at a situation that I think is costing us more money than what is giving us the best bang for our buck, if I can use that expression. And we have a couple of instances and a couple of organizations that are doing some stupendous work for a lot less. And what would compel me to make a change would be to do more with less. We could do more services with more people with the money we have. And we could extend that hope and that humanity to people that couldn't find it, especially in our case. So I would hope that would be what we'd decide on today. That was a better move for a better future in my mind. I'm not at all supportive of number 2, closing the center. I think there's a transition we can have in a very short period of time that can be a win for the community and for the NAV Center and for our current suppliers of great human services that we've already acknowledged. But at the same time, I can't express the amount of my disappointment that we're still talking about this a year later when we could have had this solution before us sooner. So sooner the better. I would like to support something, a modification of number 1, but I won't be in support of the full way it's printed now. Thanks.
Well, and I would just like to bring this back down to the ground level. I mean, I appreciate Commissioner Trieger, what's our end goal here, but we also do have a problem at the ground level. We see it. ESS is currently not being the best neighbors they can be. We're not being the best landlords we can be. And that is a concern. It's something I hear all the time. Granted, it's in my district. I think Charlie Rojas spoke to you because I inherited it from you. Originally, this was Pat's baby. It's simple ESS is very reactionary. They're not, I haven't found them to be proactive. Commissioner Lovell kind of hit on it. They clean up when we're going to have an event, when somebody's going to visit, everything gets cleaned up. That's happened for just my tours when I swing by there. But they've also told me they're not going to allow broke down cars in the parking lot. There's a slew of broke down cars in the parking lot with tarps on them that look like additional shelters. And those are the kind of things that really frustrate neighbors when they get told they're not going to do this and then they do it. So after this meeting, people are upset about it. Maybe it'll get cleaned up, but it's just going to come back. And, James, you hit on something earlier. They've hit every matrix we've asked of them. Maybe we needed to ask them to do more. Maybe we need to have better, good neighbor agreements. I think these are the kind of steps we're going to have to take if people are not going to throw an absolute, I don't want to say fit, but a fit when one of these are going to come into their neighborhood. I mean, how do we get away from that NIMBY mentality? We start doing better. That's how we do it. I mean, that's the bottom line. So at this point, I'm not going to support ESS any further, but I'm willing to entertain a motion. Commissioner Farr.
Just a quick item of summary regarding the proximity of this facility to neighbors. Last night we had testimony in Springfield on the stabilization center. People love the idea, just not in my neighborhood. And I'm not going to underplay the fact that these things do occur in people's neighborhoods. Lieutenant Sullivan said that the criminal activity surrounding that's evident in that area the genesis isn't the navigation center. And I don't know how true that is. I do trust Lieutenant Sullivan of the EPD, absolutely trust what he has to say. But that being said, we don't really know. On Highway 99, we have a large number of people who stay at dusk to dawn. And if you drive down 99 at 8 o'clock in the morning, watch out. And I'd invite the people who live on River Road to drive down 99 at 8 o'clock in the morning, because it's not only in this area, it's all over. And if we do something with the population in the navigation center right now, where are the people who are in there? The high security people in our community, the highest people on the fuse list are in the navigation center. Where are they going to go? What will they do? They'll be redissolved back into the community, which is already at a high rate. We're already at capacity. So the people who are being treated there will go back into the community. So at this point in time, we do have a better model to look at now, and over the course of the next few months, we will have a better, clearer understanding of what we can do with the navigation center. If we close it down today or in 3 months, if somebody else goes in to operate the center, I don't know that they could do it with the same walls, for instance. There's construction that would need to happen to separate populations, whatever it may be. I don't know all of the answers to that. So I believe at this point in time, having a clearer understanding of what the other programs in the community are than we had a year ago. And Gabe says, and I'm going to quote, every one village has a model that works. Darn right it does. Absolutely does. But would it work in the navigation center in its current configuration? I don't have the answer to that. And to take a chance on that is not something I'm willing to do at this point in time. I believe having a year of a very aggressive year of identifying what it does we would like to see in the navigation center and have the RFP correspond to that, then I think we'll have an opportunity to be more successful than shutting it down now or 90 days from now, or moving into a different model 90 days from now. I think number one gives us the best opportunity for long-term, long-range success.
No, I just want to clarify. I don't think anybody was saying shut it down right now and those people are out on the streets. I mean, I just want to clarify that's not.
Well, now or 90 days or 1 year.
Yeah, well, then at that point, why are we having this conversation? Commissioner Krieger.
Thank you. Thank you for that, Commissioner Farr. I will point out, were those people to be on the street, many of them, the answer is, would be dead, as we heard from what the front door assessments show us. So there's that. I did want to provide or ask for one point of clarity to ensure, I hope everyone on this dais understands this, but to ensure the public understands this. The order before us, should we get to a motion, is about adding funds of about $2.3 million. Those are funds from the Oregon Housing and Community Services. Those are state funds that come to us to support a shelter system. Those are not locally generated dollars, correct?
Correct. At this point, we have a larger pot of dollars, which do include local Human Services Commission funds, as well as other state funds. And today, my understanding is this is just the statewide shelter program funding for the Navigation Center.
Thank you. And finally, I want to point out, I'm really glad you put this in the agenda item cover memo, a reminder that the genesis of even having a navigation center grew out of one of the sort of highest ranking recommendations from the TAC report, the Technical Assistance for Community Services, which was developed before some folks were on this board or involved in this work. And it was identified that for a community of our size and with the number of unhoused and unsheltered folks we must have a public shelter. And that is what we have been able to bring to fruition. It has been sort of a gold star in an otherwise fairly bleak and certainly challenging circumstance around the evolving needs of unhoused and unsheltered people in our community, that we have a public shelter, and that is what the Navigation Center is. And I don't want us to lose sight of that was a long time in the making, and then something that that we can be really proud of. And again, it's really inappropriate for this to become a referendum on providers. All of our providers do exceptional work, important work, valued work, And most importantly, all of the people who are sheltered in our system deserve the dignity with which all of these different providers serve them in their own different ways in the models that they provide. So thank you, Chair, for another couple of minutes and another round. And I'm happy to make a motion. I don't know if Vice Chair is prepared for a motion, then we can discuss the motion if there's not something new for other commissioners to add to the conversation. Thank you.
Commissioner Lovell.
Yeah, I've put point of clarity here that my commissioners' friends keep asking, and I've got one myself. Is the state really only giving us $1.1 million and the rest of that 2.3 is matched somehow with our general fund? Did I misunderstand that somehow? Is the actual amount we're getting from the state $2.3 million?
No, the total amount for the statewide shelter program is $8.7 million. And there was a comment about 1.1, and it's that we received $1.1 million more for next fiscal year than this fiscal year.
So there's no general fund money, the county's not matching any of these funds to run the navigational center in any way, because that was some of the confusion I had with some of the constituents.
So at this point, when looking at the array of funds that can support the navigation center, it is strictly the statewide shelter program funding.
Okay, thanks for that clarity.
Okay. Mr. Trigger.
Would you like a motion?
Please.
Sure. Chair, I move approval of Order 26- excuse me a moment. My lozenge timing is off this morning. Move approval of Order 26-06-02-06 in the matter of adding funds up to $2,328,924 and extending the contract with Equitable Social Solutions for Navigation Center operations through June 30th, 2027, and delegating authority to the county administrator, their designee, or subdelegate to execute contract documents.
I'll second.
Just to clarify, is this option 1 or 2?
Through June 30th, 2027, so that's option 1.
So go ahead, Commissioner Farr.
To the motion.
Yeah.
And I think to your question, Chair, that it does take into account the discussion that we have had regarding an aggressive, enthusiastic, and energetic approach to a new RFP, which will be issued next year, with the different requirements in the RFP, as per our discussion today, and as per the work that's been ongoing. Is that clear to everybody? That the motion doesn't exactly state issue a new RFP for a new contract to start 7/1/27, but it does imply that. Does that? Or it does take into account the conversation that we have had surrounding the new RFP. Or do you need a separate motion to regarding the new RFP?
I think what we need to commit to doing is coming back and having more conversation with the board about what is contained in a new RFP, because we have a new continuum of care agreement that is coming out that we're digging into and trying to understand how that will impact our shelter system. We have changes to the state rules for funding that will impact our shelter system, and we have this conversation. I think we probably need to lay it all out and really talk about what is it that we are contracting for this facility and get the board's agreement on that, and then move to an RFP. What I can say is that we can commit to doing that process, even if that is not contained within the motion itself.
Just a clarification, you'll commit to doing that process, which will include issuing a new RFP to start 7/1/27, and we'll discuss the details of that between now and the issuance of the RFP. I'm not going to vote yes on this unless I know that.
I believe that that option 1 was committing to a new RFP. So that was our understanding. If the board is asking us to do option 1, we would be committing to a new
Council
RFP.
has a comment.
So the state procurement laws require an RFP to be issued over a certain dollar threshold. The dollar threshold is $250,000. So the amount of the contract being contemplated automatically requires an RFP to be issued. So
didn't clear
your
anything up.
order does not need to include requiring an RFP, as the state laws already require it.
I think the one caveat there is
Yeah.
that we ran the RFP and it's good through 2028, June of 2028.
Oh, that is correct. So
but-
yes, you can issue a new RFP, but if this contract is ending and the board order is to not renew again, and it will be the definitive end, June 30th, 2027, we will need to issue a new RFP based off of the amount of the contract at issue.
So the order includes extend the contract for the Navigation Center through June 30, 2027. So something will happen between now and then, which will include a consideration of the new. Once again, I'm not going to vote yes on this unless I know that we're going to take a really aggressive look at how this Navigation Center is functioning and what is going to be a better approach for the future. So.
Would it suit to amend the motion to say, adding the funds, et cetera, Navigation Center through June 30, 2027, with the understanding a new RFP will be issued in advance of that deadline, in appropriate advance of that deadline?
That's fine, yes.
Would that satisfy, Commissioner?
Does that lock you into a new RFP? Yes, I think it does, yeah.
And I think what I think is we ultimately need more direction from the board on what that new model should look like.
Absolutely.
Because I don't think we have clarity on that today, but that's okay. We don't have to accomplish that part today.
And I don't have clarity on that today. I don't, because I need to hear more from you. And I've been out there, 5 times in the last month, and every time I go out, something new is going on. So it's remarkable what we're seeing, the evolution. And between now and the time the RFP's issued, I think I'll have a clearer picture of what we can do, either with the Navigation Center or with everything surrounding the Navigation Center. So the picture is getting clearer and clearer all the time, as long as we have this point in time where by this time next year, we're looking at a different model for the Navigation Center, potentially. We've at least considered a different model for the Navigation Center. Thank you.
So if the seconder of the motion approves that amendment with the insertion of, with the understanding an RFP will be issued in an appropriate timeline, then we can talk later if we need an assignment during assignment requests on this, or if it just becomes part of the quarterly homelessness service update or what, right? Does that suffice for staff? Great, thank you, Chair.
I have to apologize for my tenseness. I don't like being tense. Sorry.
Okay. Still looking for a second.
Oh, I second.
Oh, you did second.
The amended.
Oh, gotcha. The amended, okay.
And if I might
Please.
comment to the motion. As I started in the beginning, I think there's an opportunity for us to make a leap in the quality of the metrics that is presented based on the people we serve, rather than the beds or the building or the house. Because ultimately, it is about the humans that we are trying to help. So if there's a way to advance that through partnerships with other institutions, I think that will help the larger conversation, because oftentimes agencies are used to using the type of metrics they've used in the past, year after year. But we know in this particular realm, when we're talking about humans, we need to continually question the metrics that we're using, if they're accurate, if they give us the full picture. And circumstances change in the community with the population that we're serving year after year. So however we can advance those quality of metrics, I will be very supportive of. In addition to that, you had mentioned a couple of questions at the end of your slides, things that we need to talk about. We have already had a conversation about a local preference. I'm still a fan of a local preference, but we decided not to move forward with that at this point. You also mentioned when we're looking at RFPs, it is very important to me that we are providing people with a living wage and benefits. And when we're reviewing different entities or different RFPs that are coming in, I want to see if we are actually providing that when they submit their applications. Because different entities do it different ways. Some people can't afford to provide benefits in these nonprofits that we help fund. But we know that we have a model that does. And I just want to make it crystal clear that that's very important to me going forward. Thank you.
Okay, so just to clarify, we have a motion made by Commissioner Trieger to approve Order 26060206 in the matter of adding funds up to $2,328,924 and extending the contract with Equitable Social Solutions for Navigation Center operations through June 30th, 2027, with a RFP to be issued before then. Seconded by Vice Chair. Any further discussion? We're only at 87 minutes on a 60-minute item. Thanks, James. Okay, I'll call for the vote. All those in favor signify with an aye.
Aye.
All those against say nay.
Nay.
Nay. Motion carries 3-2 with Lovell and Seneca and nay. Thank you very much. Okay, next up we have Public Works. I see Jay Blome, who's been patiently waiting in the seats on order number 26060207 in the matter of increasing the fee for the Public Land Corner Preservation Fund.
Good morning, Commissioners. I'm joined today by Erica Houston, who is a Public Works Budget Analyst, and she'll be attending via Zoom. I'm here today to request a $15 increase to the per document recording fee for the Public Land Corner Preservation Fund. If approved, this adjustment will establish the total fee allocated to this fund for documents recorded at Deeds and Records at $25 per document. Lane County's Corners Preservation Program is budgeted in Fund 240. This legislatively mandated program is administered by the Lane County Surveyor's Office, and its primary mission is to maintain, establish, and reestablish approximately 14,000 section corners, quarter section corners, and donation land claim survey markers located throughout Lane County. These markers form the foundation of the public land survey system established by the federal government after the Revolutionary War. They represent critical public infrastructure serving as the points of beginning for legal land descriptions within the county. Every property legal description and survey is ultimately tied to one of these survey monuments. Revenue for Fund 240 is generated through the Public Land Corner Preservation Fund established under ORS 203.148 in 1985. For nearly 4 decades, revenue has been collected through a $10 per document recording fee for every document filed with Deeds and Records. Until last year, statute capped the per document fee at $10. The legislature has since removed that cap and amended the statute to allow each county's governing body to set the fee based on local needs. Because this revenue stream depends on recording activity, Fund 240 is closely tied to the economy and the strength of the housing market and has been structurally imbalanced in most recent years. If not for a 90% FEMA reimbursement that I have been receiving due to the Holiday Farm Fire, this program would have required additional funding sources long available before now. With the removal of the statutory fee cap, the county now has the opportunity to stabilize this essential program. Following the recent legislative change, I consulted with Public Works budget analysts to identify an appropriate adjustment to the current $10 recording fee required to sustain the corner restoration program at its existing level. without expanding staffing or services. The analysis resulted in 2 potential fee increases, $10 or $15. After reviewing both options at the Finance and Audit Committee, the committee unanimously recommended proceeding with the $15 increase, as this option most clearly supports revenues keeping pace with the expenditures through fiscal year 2030 to 2031. 2 attachments are included with this agenda item for your review. Attachment 1 provides a revenue expenditure chart reflecting no fee increase. Attachment 2 provides a revenue expenditure chart incorporating the proposed $15 increase. Erica, would you mind sharing attachment 1?
Jay, while we're waiting, maybe you could explain this to me real quick. Where are we going to see these fees? Who's going to pay this, and what's the average cost going to be?
Okay, so anytime someone goes down to Deeds and Records and records a document, say it's a refinance or maybe they purchase a new home, they record an easement, this fee will be attached onto the regular Deeds and Records recording fees. So Deeds and Records actually collects this fee on our behalf, and they currently keep 50 cents out of that fee for administrative costs.
Gotcha.
So the public pays for this service.
Gotcha.
Thank you, Erica. So as you can see on attachment 1, revenues in the upcoming fiscal year are projected to meet approximately 90% of the amount required for structural balance. By fiscal year 27-28, the gap is projected to widen further, with revenues meeting only about 60% of necessary expenditures. Could you please share attachment 2?
I think that's attachment 2.
Yes, it is. So attachment 2 demonstrates that a $15 fee increase would maintain revenues and expenditures on a nearly parallel trajectory through fiscal year 2030-2031, thereby keeping Fund 240 structurally balanced. I would also like to point out that, many counties in Oregon are currently encountering similar funding challenges in their corner preservation programs. Among our 5 comparable counties, pending or approved fund increases reflect a similar need to address structural funding gaps. Clackamas County has approved an increase of $20 per instrument recording fee for $30 in total. Deschutes County has a pending increase of $5 per document recording fee for $15 total. Jackson County has a pending increase of $15 per instrument recording fee for $25 total. Marion County has a pending increase of $10 per instrument recording fee for a $20 total. And Washington County has no planned increase at this time. So you can see that our analysis puts us right in the range of our 5 comparable counties for this fund. So that's the majority of my presentation right now. I'd like to open it up for questions for either Erica or I.
The board? I just have one. It says per instrument recording fee. Is that per deed?
Yes,
Same.
per document, yes.
Per deed.
If you were to refinance your home and you file a new deed with Deeds and Records, then there would be, if approved, currently there's a $10 fee that's added to that total document recording fee. If approved, it would be $25.
So how many, for refinance, how many instrument recordings, or how, how many pieces of paper do you get usually? Is it just one deed?
Well, one document, it could be multiple pages.
Gotcha. So
Does
it's
that
per
answer your
page.
question?
Yeah.
Yeah.
It's not per page, it's per document, right?
So it's $25.
I do believe Deeds and Records does charge per page. So I think it's $5 per additional page. So if you had, a 3-page document, you would have your standard recording fee, and then they would charge you $10 extra for each additional page. But our total fee for that entire document would be $25.
Gotcha. That makes a lot of sense. Okay. Council.
I just noticed, and you may have already going to do this, but I noticed that ORS 203.0148 subsection 2 requires we allow for public input. So I see there's only a couple people here, but we do want to open it up to see if anybody has any comments about this.
Do we have any comments since Harris Hall?
DJ, Sasha?
Thank you.
Thank you.
Appreciate it. Mr. Trigger?
Thank you. I'll just note, this is just another example that keeps surfacing of how constituents in Lane County have been getting a really good deal on a lot of services for a long time. And I think it can feel hard when things start to culminate in a time of scarcity and contraction and challenge and time sort of catching up to us. But this is not the first time we've heard about a service we've been providing that's comparable to other counties at a rate that's far lower. And it's just a hard place for us to be in and for the public to be in. It sounds like we're just raising rates for no reason, but really, I often say it's like you sign up for the free gym membership and then your 6 months free is up and you got used to going without paying, and that was how it works. So yeah, thanks for the presentation.
Sure. Just for context, I'd like to point out that when I started the county over 25 years ago, this $10 that we are currently getting funded 5 survey crews. So in that amount of time, we've had to eliminate 4 of those, and we're down to 1 survey crew right now. So this was much needed.
Thank you.
Great context. Thank you.
Great. I'll move approval of Order 2606-0207 as presented.
I'll second.
We have a motion made by Vice Chair to approve Order 2606-0207 in the matter of increasing the fee for the Public Land Corner Preservation Fund in accordance with ORS 203.148, seconded by Vice Chair. Any discussion? Seeing none, I'll call for the vote. All those in favor signify with an aye.
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 Motion carries 5-0.
Thank you.
Thanks a lot. Appreciate it. Okay, next up, we have County Admin. An election update for us?
Thank you, Chair. I have an elections update. I don't have any announcements, so we can move on after that. Commissioners, the elections team continues to process Lane County ballots received from other counties, ballot curing, adjudicating ballots, and ballot resolution reconciliation. A total of 127,152 ballots have been returned. That's a 44.6% turnout for this election. Very high, almost 10 points higher than 2 years ago. As of noon yesterday, there were 1,084 challenge ballots. That includes 177 ballots missing a signature and 841 signature discrepancies. To resolve, or as we say, cure the challenge, these voters were sent letters with instructions to cure the challenge. So if you had most of these, again, are signature discrepancies. Some of them are missing signatures. You would receive a letter to cure the challenge, and the deadline for that is June 9th. That's next week. The elections office will remain open until 5 p.m. to assist any voters to cure their ballots. Election results will be posted 2 more times in the coming weeks by 5 p.m. on Wednesday, June 10th, and Monday, June 15th. Election results are unofficial until the election is certified on June 15th. And as always, we suggest that folks visit our elections website for results, the ballot return dashboards, stats for challenge ballots, and other useful information at lanecountyor.gov/elections. And that's the elections update, E+14.
E+14. Okay. No, we have no questions. We'll move on to commissioner business. Do we have any announcements? Commissioner Trigger.
Thank you. I just want to acknowledge publicly, we lost a fellow commissioner from Wasco County, Phil Brady, unexpectedly on Election Day, and he was just a really kind and decent human and did really excellent work, and it was a real shocker to everyone. I just wanted to speak that aloud in his honor.
Yeah, thank you for that. Commissioner Farr?
Just look through the window, the
I know.
strawberry is right across the street.
Yeah, we gonna get another flat of them?
Yes, you may benefit from that.
Excellent. Any commissioner comments or remonstrance? On to committee reports. Okay, and do we have any future board assignment requests? Seeing none, I will read us into executive session. Oh, no, not yet.
Actually, we have another public session.
Item at 1:30 in the BCC conference room. So we will recess until 1:30 and we will re-adjourn the BCC conference room. Thank you.